This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Good morning, everyone. I'm Renee Summerhour with the Las Vegas Review-Journal. We're about to take you to a live virtual press conference where the Southern Nevada Health District will discuss its decision to halt its use of the Johnson & Johnson vaccine. Let's go ahead and take a listen.
I want to say that as today here in the whole state of Nevada, there hasn't been any case reported with those severe events. So that's the first thing I want to say. Also, here in Clark County, until yesterday, we have administered more than 47,000 doses of Johnson & Johnson. And what we have received are reports of minor adverse events by about 58 people, I believe, from the county, and those are, go from, pain on the side of injection to other minor things. So, according to the federal report on those 6 severe adverse events, basically those rare clots that were reported in 6 people across the country. What they describe is that they have been women between 18 and 48 years old. Those events occur between 6 and 13 days after vaccination. And the most important thing for those who already received the Johnson & Johnson vaccine at this point is to monitor for signs or symptoms that might be suspicious of this condition. This recommendation is mostly directed to people who have been vaccinated within the last 2 weeks or 14 days. The signs and symptoms that people should be looking at are a severe headache, also abdominal pain, leg pain, or shortness of breath. And again, this is something that they have to be, very vigilant within the initial 2 weeks. But just as a piece of caution, the federal government recommends that we should extend that monitoring up to 3 weeks, just to make sure that nothing is missed on that regard. So this really is the main recommendation that we will offer today to people who recently vaccinated with Johnson & Johnson. Those who received the vaccine more than 3 weeks ago, at this point, really, they are not considered at high risk or even risk for this condition, because again, it's something that has been observed within the first 13 days of vaccine administration. Thank you.
Next question today is from Mary Hines.
Thank you. Good morning.
Morning.
What effect do you believe that this development will have on the vaccine campaign in terms of both vaccine availability and vaccine hesitancy? Is this a big blow to the campaign?
Thank you, Mary. Well, certainly it's a big reason for concern in both ways. Right now, as most of you know, we have been working with the county and the cities and also community partners, trying to encourage our population to go and ask for the vaccine, with a big emphasis in our minorities population, especially the Hispanic and African Americans, where we haven't seen a strong demand for the vaccine, and we trying to encourage that. So, in the other hand, we are looking at the Johnson and Johnson vaccine as as a very efficient tool in terms of advancing the vaccination campaign, because it is only one shot, meaning that once you administer the vaccine to a person, that person is expected to be protected within, after the initial 2 weeks from receiving the shot. So it gives you an advantage in terms of logistics, because you are able to move your vaccination campaign faster than when the vaccine requires 2 doses, as it is the case with Pfizer and Moderna. So right now, we also have to go back. First we have to wait for the recommendation from the federal government, the CDC, FDA, and also tomorrow the ACIP, which is the leading organization for immunization services. They are meeting tomorrow, and we are expecting recommendations that will come from that meeting, and then we have to regroup, of course, and reorganize and how we address this campaign, how our communication with the community is impacted by this thing that's happening right now. But again, we will wait for the outcome of tomorrow's meeting with ACIP, and also the federal recommendations before we move forward. What we had done today, early this morning, was to stop the distribution of Janssen and Janssen at Clark County vaccination sites, and we communicated with our partners and asked them to stop offering the vaccine until we receive further information from, again, the federal government on this regard.
From the chat box, we have a question from Will Stone from NPR News. Can you discuss what kind of impact the pause will have on vaccine appointments and the rollout? Are there certain clinics being impacted, and will people have to reschedule?
Sure, thank you. Well, in terms of vaccine appointments, the impact is minimal today, because we receive very limited number of doses of Janssen and Janssen. There were some events scheduled today to administer Johnson and Johnson, and those were stopped, as I mentioned before. But as I said, so far in Clark County, we have administered about 47,000 doses of Janssen and Johnson, compared to the over 1,100,000 doses that have been administered already in the county. Those doses, mostly Pfizer and Moderna, as you know. We have received a very limited shipments of Johnson and Johnson so far. So at this point, our planning for the campaign was not based on Johnson and Johnson, because again, the small number of doses that we have received in recent weeks. So all our planning have been based on those two vaccines, Pfizer and Moderna, until Johnson and Johnson will be available from the federal government. Now, of course, with these events, that might be delayed a little bit further. But so far, our campaign is not being adversely impacted in terms of the way that we organize, because it wasn't based in Johnson and Johnson yet. But of course, our expectation was to receive larger shipments of Johnson and Johnson in in the future, and that will expedite the process and how fast we move with this campaign across the community. Now is something that is on hold, of course. Thank you.
Next up is Ms. Jacqueline Schultz.
Hello, everyone. Hi, Doctor. Certainly, the Southern Nevada Health District had launched vaccinating homebound seniors. I know Johnson & Johnson has been utilized for those who are homeless, for those who might not be able to return for a second time, for the rural communities. This has been so crucial for access. What now for the next few days? How long is this pause anticipated for, and are those programs to reach those who have less accessibility, are they on hold, or is the health district going to figure out a different plan for administering Pfizer or Moderna to those populations?
Sure, thank you. Well, first, as I mentioned before, tomorrow there is this meeting from the ACIP at the federal level, and we are expecting recommendation from that meeting. Now, having said that, I also would tell you that our immunization campaign still is moving forward with the Pfizer and Moderna vaccines, and we are planning to offer those vaccines as before at our vaccination sites with our strike teams and through other interventions. We will wait until we receive further comments or recommendations from the federal government in terms of Johnson & Johnson. Based on that, we will redefine our strategy with hard to reach populations if that need arise. So we will wait until that, and that answer most likely will come in few days. Thank you.
Next up is Ross from KTNV.
Thank you. Dr. Leguen, today's news, I think, delivers a hit to the confidence surrounding the vaccines throughout the country. So we know that there's a lot of people who are admittedly still on the fence about getting any of the vaccines. What would you tell those folks in light of today's news about just the confidence that they can have in the other vaccines that are still available? How would you convince them to still go out and get that shot?
Sure, thank you. Well, vaccine hesitancy or being on the fence before deciding whether to take a vaccine or not is something that is not new, is not exclusive to COVID vaccines. It's something that we see with any other vaccines that regularly are offered to the public. Our message today is that our campaign is based in multiple vaccines, and also we expect new vaccine to come to our campaign as a FDA, complete the process of approvals or emergency authorization of vaccines. Now, the vaccines that we are offering, Pfizer, Moderna, those vaccines have been proved to be effective and also to be safe, and those numbers that we have locally here with more than 1 million doses already administered in this community attest for that, and not to mention the millions of doses that have been already administered across the country. So in terms of Johnson & Johnson, we will wait for the outcome of the federal investigation, and based on that, we will follow the recommendations on what will be next. But in terms of communicating with our residents and the Clark County community, we feel very comfortable telling them that the vaccines that we are offering to our community are safe vaccines, and that's the reason why they are being offered And regarding Johnson and Johnson, we will wait for the outcome of this investigation and what recommendations are coming from the federal government.
Our next question will be the last of the English portion of this availability, and then we'll move on to the Spanish. So right now we have Mr. Jeff Gillen.
Dr. Leguen, Jeff Gillen here, Channel 3. Good afternoon, everybody. I have two questions very quickly, Dr. Leguen. Of the 47,000 doses of J&J that we have given out here, could you give me an idea of where those doses were given?
Well, those have been offered at the Cashman Center, a certain number of them. Also at community events, for example, at City of North Las Vegas, the last 2 weekends they have offered Johnson and Johnson there. Also, strike teams going out in the community for a specific populations. They have offered that. They have offered also to the homeless community, and I believe also we have offered that in the correctional system as well.
I have one other question, if I can. You had mentioned at the beginning that there was a small group of people with the J&J vaccine here who experienced adverse effects. Can you tell me how many and what exactly were the effects that they experienced?
Yeah, absolutely. I don't have the report in front of me. I can tell you it's 50. I don't know if it is 52 or 56, but it's in the 50s. That number, and when you compare that with the number of Johnson and Johnson vaccines that we offer here, which is again over 47,000. Really, the proportion of people who complain of those minor adverse events is minimal. Is about one or two over 1,000 or something like that. But again, those minor effects are again, pain at the site of injection, or people, feeling some kind of fatigue or dizziness, or immediately after injection. Those have been the most common ones, and again, those have been reported to us, and we submit those reports to the federal government. I also have to tell you that these are the reports that we receive at the health district, and there is a reporting system for that share the information with the federal government, so that allows them to actually capture information from all over the country about adverse event to any vaccine. So that's the data that we have.
Thank you, sir. We're going to take one question from Hillary, and then we'll move on to Alexander. Hillary, go ahead.
Thank you. I understand that the Johnson & Johnson doses have represented a small amount of our overall allocation, so I might be rephrasing a previously asked question, but how long can we go without the Johnson & Johnson vaccine in the lineup before we start to feel a pinch of having fewer doses available?
Okay, well, thank you for your question. Well, actually, as I mentioned before, the number of doses of Johnson & Johnson that we receive in Clark County is very small. So the impact of this actually, it just adding to our, I would say, frustration, if you wish, that this vaccine was not available in large numbers as we expected in previous weeks. and the shipment distribution of the vaccine, Johnson and Johnson vaccine, has been very slow after the first 2 weeks. So we received our vaccine allocation weekly. We never know how many vaccines we are receiving. The following week we make a request for X number of vaccines according to what information we receive through the state, and then we place that request, and sometimes the request is granted fully, sometimes the amount is decreased. But when it comes to Johnson and Johnson, our request has been small because basically there was no Johnson and Johnson fully available for us or anyone in the country. So the long-term implications really go beyond what happened today with those adverse events. It's more about the production and distribution of Johnson and Johnson in the country that have been affected, as we know. Thank you.
At this time, we will be moving on to Alexander Sabata. Unmuting you now.
Leguen, ¿puede escucharme?
Sí, te oigo, sí.
Doctor,
You just heard from Dr. Fermin Leguen, Chief Health Officer for Southern Nevada Health District, talking about a number of different things regarding the Johnson & Johnson vaccine. He was talking about the kind of low impact the vaccine distribution has here in the state of Nevada, and it's more of a logistical issue getting the vaccines out to those who don't live in the nearest of the Clark County metropolitan areas, more in your rural areas. He also talked about some of the reports regarding those people who have had any type of adverse effects here in the state of Nevada. He said that it's in around the 50s range, but all of that is reported to the federal government. Along with some other questions there, we will have all of that continued coverage of more of this developing story online on our website at lvrj.com, and we will give you an update for this for you this evening at 7 p.m. And as always, don't forget to download our free RJ mobile app to get these types of alerts sent straight to your phone. And of course, if you continue to subscribe to us, you can watch us on Roku, Apple TV, and all of your favorite digital platforms. I'm Renee Summerhour. Thank you for joining us.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.